This is the old one.
Okay.
I know. I like the copy. Buenos dias. Good morning. We are live on Facebook and live on YouTube. And on YouTube, for those that are listening, you're actually watching and looking at our guest today. You ready?
Yeah.
Go ahead.
All right. Whoa. What happened here? Okay. Are we good? All right. Good morning, ladies and gentlemen. This is Nuestra Comunidad Northwest Indiana. It's the only English-Spanish live talk radio program since, actually, yesterday was October 30th of 2020. We started Nuestra Comunidad Northwest Indiana on October 30th of 2010. So we're just making this our 10-year anniversary weekend. And so this is our first show during this weekend, other than yesterday's actual celebration show. Thank you. And today we have two very special guests. Actually, he said he lives in Frankfort, Illinois. Is that correct?
Yeah, that's
correct. And then
correct.
Deborah, no where she lives, but they're here representing, in a sense, St. Catherine Hospital. Okay. And so we have a disclaimer. Eve, what is our disclaimer?
Yes, the views expressed by the host and the callers of this show, not necessarily the views of WLG Radio Management, owners and sponsors, and advertisers.
Let me also say this here. Our call-in number is 219-885-1371. Let me announce our two guests, and then I think Eve may have some announcements for today before we go to our very special program with Dr. Carlos Gonzalez, and who is a robotic surgeon. And sitting next to his left is Deborah, and then make it easier, G
Debbie
Brown.
G. Debbie G is in the house.
And she is the marketing director for St. Catherine Hospital. Eve, announcements, please.
All right. Buenos días, ¿cómo están? Aquí estamos en vivo desde nuestros estudios WLTH, AM 1370 y 92.7 FM. And if we sound kind of funny, it's because we're all being cautious today. We have medical representatives here in the studio, so we may sound a little muffled, we may look a little weird, but that's okay. It's still us here live in the studio. Buenos días, feliz sábado. Hoy estamos aquí con unos invitados especiales, así es que no se me vayan, pónganse listos para agarrar información acerca de lo que está pasando en el Hospital Santa Catarina. We got some special things going on in St. Catherine's, and that's why Juan brought them here today, so that we know and we learn and we educate ourselves, because there's always something new to learn every single day.
And on that note, we have our two very special guests for the whole hour. And Deborah, we'll give you the lead right here, because the theme of today's show, if I could just read that.
Yes.
How St. Catherine Hospital, at an unprecedented time in our lives, grappling with a pandemic not seen since 1918. And would that be the Spanish flu or something like that in 1918?
Yeah.
Okay. Has not lost sight of its mission to stay in tune with technological advances and treatments to best serve patients of all economic means, races, and walks of life. So St. Catherine Hospital East Chicago has undergone significant metamorphosis over the last several years. So we're going to be talking about this theme, about the mission of St. Catherine Hospital, and of course about Dr. Gonzalez, who is a robotic surgeon. And I did print out the pictures that you sent, Eve and me. So, and I did have an opportunity. So I did have an opportunity last year, as I asked you, Deborah. I was at the demonstration that was in the lobby. I think it was in the summertime at St. Catherine Hospital with an actual robotic machine, I guess, whatever you call it. And it was, you know, in use. It was there for people, I guess, or the doctor there to put it in practice so that we can all see. So on that note, we want to thank you, Deborah. We want to thank you, Doctor, for being here today. And our first guest after our 10-year anniversary. This is our 10-year anniversary show.
Sí.
So
So it's a special occasion for you guys being here on this special day or weekend. It's awesome.
Very good. So, Doctor, tell us a little bit about yourself that has nothing to do with what we're going to talk about today. What would you like to let our listeners know and streamers know?
Yeah, of course. Well, first of all, congratulations for those 10-year anniversary. That's a very terrific goal you guys have achieved. I really congratulations. Thanks again for your time.
Thank you
for having us this morning. So I'm originally from Venezuela, South America. I did med school back home in Venezuela, and then I have been always learning this minimal invasive surgery, and that approach. I did think that I could achieve this here in the United States. So I went to Indiana University Med School for my training in general surgery. Then I graduated from general surgery back in 2014. So I have been practicing since 2014 general surgery, mainly focusing on minimal invasive surgery and robotic surgery. I did practice for a little bit down south in southern Illinois, and I just joined this terrific community hospital, St. Catherine Hospital, just recently in April. And it has been a very exciting moment in all this difficult pandemic, but it's been terrific.
Okay, Deborah, I read off a little bit about what you sent us in terms of the mission of, St. Catherine Hospital, trying to fulfill its mission, from the past, present, and going on into the future, which is a great thing. But if we could just take a minute or two, because of the COVID, and it looks like, I don't know what, let's say, situation is St. Catherine is in terms of maybe compared to other hospitals that have been hit by numerous patients that has affected their budget and everything else. So is St. Catherine Hospital, more or less, generally speaking, in good standing compared to some of these other hospitals that were bombarded with patients for COVID and I think, if I heard this correctly, hospitals make their money sometimes by elective surgery, cosmetic surgery, and they have to put all of that aside to deal with their COVID patients. So how strong is St. Catherine Hospital right here and right now?
We're doing very well.
Okay.
I mean, everyone is challenged by what we're facing.
Okay.
I think it would be safe to say that we are all challenged. Mm-hmm. To say that we're on shaky ground is that would not be a thing that I see at all. I think we're stronger and better than ever. We are dealing very effectively with the COVID situation. We've put a number of policies in place to keep our visitors and our patients safe, and we're following all the protocols that we need to follow. We're paying very much attention to how we respond to our visitors and our patients, and how we separate COVID presumptive patients from others. But I really think that all of the hospitals within community healthcare system have been responding in a very responsible and effective way. Now, these are uncertain times. So, so as you can see, we're all masked here today. We're making sure that we have our sanitizers and our little sprays and things like that, so that we can be as careful as we possibly can.
I'm going to do one more question, and then we'll go into the questions that you have for us. So, I live in East Chicago. I lived in East Chicago all my life. I remember all those times I was going by the parking lot in East Chicago. There were no cars in the parking lot, other than, I think, the cars that belong to the employees there. Mm-hmm. Now I'm going by St. Catherine Hospital parking lot, and I see cars that I think are public-owned cars. So what's changed there? Why am I seeing cars now in the parking lot that I didn't see before?
What's changed is that we reopened our visitations policies. So there are visitors who can come in. It's still a limited amount. And we screen everybody as they're coming in. to make sure that they don't have a temperature. We ask them all of the questions to, or have a sign posted to make sure that they don't have the COVID symptoms. And we just feel that because of the limitations that we've put in place and how closely we watch and monitor this, that we have felt as we watch the numbers that it's okay for some visitation. Some staff is coming back. The elective surgeries are starting to grow again. And I think people are feeling more reassured that they can come into the hospital setting and be safe. But I would leave that to Dr. Gonzalez.
Yeah, I mean, regarding the kind of the same topic, I mean, we're checking temperatures every single person who gets in the hospital. So if the temperature is elevated, the patient or the visitor cannot get access to the hospital. Every single person in the hospital is wearing a mask. If we are keeping the 6 feet apart as well. When we are operating together, of course, we have this mask. We are limiting the amount of visitors we have. I don't think that our hospitals are as safe as they used to. I think right now with all these measures that the CDC, all the guidelines we're following, they are very, very safe. And same for the patient. We are testing the patient for COVID prior to surgery. If they are positive, we don't do surgery. So we're following those guidelines, and it's very, very safe, our hospital at this time.
Would you like to start us out? But before, can I just ask you how old you are?
Yeah, of course.
How young you are. Not old. How young?
I'm 43.
43? Okay.
Yeah, you're young.
Go ahead.
Yeah. Based on what you just said, doctor, you tested them, if they're positive, there's no surgery. What if it's an urgent surgery that's needed?
Yeah,
what do you do in that case?
Yeah, that's a very, very good point. We have a dedicated OR for COVID positive patients, and we do have all the protective, the PPE, all the protective equipment necessary for take care of these patients.
So if it's something that can wait, it's best.
Correct. For elective surgeries, if the patient is positive, we wait. But if it's an emergency surgery, even with positive patients, I have been there. I have been doing surgeries, and we have all the equipment necessary to be successful in a safely manner.
That's very good to know. En español, doctor, sé que su lenguaje es español primero, su primer lenguaje, ¿no?
Sí, español. También hablo español. Hablo mejor español que inglés.
Pues aquí podemos hablar en español. Aquí está el doctor González. Él es un cirujano robótico y es algo especial que no todos lo pueden lograr hacer, ¿cierto?
Sí, así es. Para poder hacer la cirugía robótica, tienes que tener un entrenamiento adicional al que normalmente uno hace durante el programa de residencia. Tienes que hacer ciertos números de cirugías. Todas las cirugías tienen que ser supervisadas para poder ser eficiente y para poder lograr ser un cirujano robótico.
¿Y cómo se sienten hacer ese tipo de cirugía?
Sí, esa es una de las cosas por las cuales yo he decidido hacer cirugía robótica, porque yo me enfoco en el paciente, y siempre y cuando yo haga que este paciente mejore con menos dolor, con menos riesgo de complicaciones, el paciente va a la casa más rápido, el paciente vuelve a trabajar más rápido, vuelve a las actividades regulares. Ahí es donde yo me enfoco, y los pacientes están muy satisfechos por eso.
Y me agrada tenerlo aquí con nosotros, y más que nada tener un paisano, un amigo, un hermano. Saludos a los de Venezuela que están escuchando y viendo, que usted viene de Venezuela tan joven y que le abrieron las puertas para que usted sea un más buen doctor aquí con nosotros. Así que felicidades.
Gracias. Sí, así es.
Okay, so is this the Da Vinci X1, if that's what it's supposed to be, X1, or is it supposed to be a Roman numeral?
Okay. Yeah. So we have here the XI is the latest technology regarding robotic surgery. And interestingly, we just switched to this newest technology at Catherine Hospital, and we are the only hospital in northwestern Indiana with the latest XI. We have this is a terrific equipment that helps not only general surgery providers but other different specialties, GYNs, urologists, thoracic, to perform a broad spectrum of surgeries with a very, very good outcomes and satisfaction for patients.
Let me ask you this. You said this is the latest technology when it comes to this equipment here. When did the very first such a device come out?
Oh yeah, that was 20 years ago.
20 years ago?
Yeah, 20 years ago.
Oh, wow.
Yeah, and they have been fading because with technology, they make it much safer and surgeon friendly, and with less risk of having complication because the surgery is much safer.
What kind of surgeries can be performed with the X1?
Yeah, so basically, I'm a general surgeon. So regarding my field, I can perform gallbladder, so cholecystectomies, hernia surgery, umbilical hernia, ventral hernia, inguinal hernias, hiatal hernias. I can do gastric surgery. I can do colon surgery, colectomies. Regarding GYN, the GYN partners, they do hysterectomies, ovarian resections, cysts, and all that. We also have the urologist on board as well, and they do prostatectomies, nephrectomies, and we also have the thoracic surgeon. We have a great thoracic surgeon that he works in our system, Dr. Fisher. He does a lung resection with this device, and just through a small incision, he can achieve a great surgery on these patients.
I got a question for Deborah, and then we'll turn it back to Eve here. Deborah, like I said, it was last year in the summertime that such a device, was that the X1 that was on?
No, that was
the older model?
It was the SI, which is an older model.
Okay.
So we have upgraded the model because of the successes and what we saw the surgeons could do with it. I just want to point out too, the community healthcare system, the other part that's cool about this is community healthcare system now has robotic surgery technology at all of their hospitals.
Okay.
So that includes Community Hospital and St. Mary Medical Center. I need to mention that. And that's awesome because we now have a full complement of robotic technology for our surgeries. Dr. Gonzalez, you also perform surgeries at Community Hospital.
Correct. Yeah, Community Hospital. I do go there as well, and we have 2 XIs at Community Hospital, two of them.
2 more quick questions, Deborah. What happens to the old machine when you upgrade? Or I may not be using the correct wording, but I said, what happens to the old? I just call it machine. What happens to the old ones once you upgrade?
Yeah, you trade it in.
You trade it in?
Yeah,
So
it's like a car. Yeah, you get a discount. Yeah.
Okay.
Well, that's good because
get a discount. Yeah.
they can go and refurbish and do whatever they want to do with the ones you traded in for a newer model.
Yeah.
And I am somewhat familiar with robotic surgery because my mom years ago, may she rest in peace, had a hiatal hernia repair with a robotic machine at Community Hospital. So kudos to you and the family, the medical family, that you want to continue to improve for our people. Doctor González, tenemos mucha gente que nos escucha que habla en español, y es que si no le importa que vamos de inglés a español,
perfecto,
porque
claro que sí.
tenemos muchos latinos hispanos en East Chicago, y pues ahí primordial es donde está usted, ¿sí? En St. Catherine, Santa Catarina. ¿Por qué un paciente debe de decidir de este tipo de cirugía?
Sí, yo pienso que Primero, cualquier paciente es elegible para cirugía robótica. ¿Ok? No es que, bueno, ¿será que yo soy un buen candidato para cirugía robótica o no? Todos los pacientes son candidatos para cirugía robótica. No todos los cirujanos hacen cirugía robótica. Y todos los que nos están escuchando, si algún cirujano le ofrece alguna cirugía que no es cirugía robótica, vengan a mí por una segunda opinión a ver, y con todo el respeto al cirujano que lo vio previamente, una segunda opinión a ver si yo lo puedo operar, porque yo lo voy a llevar, va a ir, como le estaba diciendo anteriormente, va a ir a la casa más pronto, va a tener menos riesgo de complicaciones y todo va a salir de una mejor manera.
And the question I asked Dr. Gonzalez is, why would someone prefer to go with this type of surgery versus the typical regular surgery?
Yeah, and I do think that, like I said, any patient is a good candidate for robotic surgery. There is no a true absolute contraindication for robotic surgery. And my practice, 99.9% is robotic surgery. Why? Because I focus on my patient, how I can get this patient back home sooner, how I can allow this patient to take less pain medication, so less use of narcotic use or abuse, and how this patient can go to the daily activities sooner, how this patient can have less complications, and that's what I focus mainly.
That's good, and it's good to know. Juan?
Why is this significant for our patient population?
Well, I think overall, when I see patients in the office, they usually say, well, I'm afraid of surgery. Why? Because of pain. Well, how long is it going to take? When I'm going to go back to work? When, how long am I going to stay in the hospital? And I said, the majority of the time, you're just going to go home the same day or the next day. I just did a patient a few days ago. I did a colectomy 2 days ago, and he's going home today. In the past, or the average nation for colectomy surgery, 5-6 days in the hospital. If you do for open ventral hernia, if this patient can go home 2-3-4 days, and I can send you home the same day. So that's I think that's very significant, because that will put this patient back to daily activities and work sooner, what they want to be. Or if, let's say that, well, I don't work, but you want to be with your family, you want to spend Thanksgiving together, you want to be comfortable doing your daily activities, and I can assure you that if you see me, or if I operate you, that's gonna be my main goal.
By any chance, do you know how many robotic surgeons there are in the state of Indiana?
I do not know the number, but it's trending up lately, because we have seen the data is there. So even older surgeons are trying to get into the robotic surgery because they have been seeing the benefit. But I do not have that number in the head of my mind.
Do you know if there's such an association of robotic surgeons?
Yeah, there is, of course. There is a robotic surgery. There is a robotic surgery collaboration, and there is a robotic association as well. Yeah.
Okay. All right. Eve?
With that being said, and having that organization, just like the AMA,
right?
That I'm sure would require or give you additional education, right? Continuing education.
Yeah. Of course, this education never ends. I'm learning every day. I'm learning today. I will learn tomorrow. I learned yesterday. So, I learn from my patients. I learn from lectures. This is a continuous medical education that we do all the time, and we have been doing several virtual meetings about this. And there is, with all this new technology and new data coming up, it's a continuous learning.
So it's not just a typical doctor just winging things off. The reason why I asked this question is because people need to know that you stay up to date with everything.
Correct.
I'm not going to say because you're young, you know more than the older ones. And the older doctors also, or seasoned, shall I say, doctors also have to do the continuation of education.
Yeah, of course, they have to. And in order to be, like I said before, in order to be efficient robotically, it's a pathway, and it takes time and the pathway never ends.
Oh, that's good. Gracias, Dr. Carlos. You're listening to WLTH, Nuestra Comunidad NWI here at 92.7 FM and 1370 AM, also live on YouTube, live on Facebook, WLTH AM 1370, and Nuestra Comunidad NWI like page as well. We love you to call in. You have any particular questions that you're not sure if you would be a candidate, or should you go seek a doctor? I know that I'm reading comments, doctor, and le mandan saludos, gratos saludos calurosos de Venezuela, y felicidades de una vez más, pero también alguien más comentó que tiene un problema médico y quiere quizá hablar con usted, pero ya antes del final del show usted va a decir cómo comunicarnos con usted, si se necesita cita o llamar a la oficina o para una consulta, lo que sea, nos va a dar esa información.
Perfecto, seguro, claro que sí.
If you want to call in, si gustan llamar con una pregunta o alguna duda acerca de lo que el doctor puede contestarles, pueden llamar al área 219-885-1371. You can call in 219-885-1371. The lines are open if you have a medical question or concern. I think that robotic surgery is the way now, but there's also a concern. What happens if the power goes? What happens? How does that work?
Yeah. So I asked myself the same question, and this device is designed with 24 hours battery that even if the lights goes off, the machine still will be on. Okay. There is always concern about are you the surgeon in the room? Who is managing the robot? Is a robot? So that's a lot of misconception.
Mm-hmm.
And
can I ask you a question about that real quick? Because I did read something in what you said.
Well, let him finish saying that.
Would go to what you may be saying right now. I read that the robotic surgeon is in the operating room with the patient. Is that okay? So as far as the latest technology right now, I thought that the robotic surgeon. Oh, so can a robotic surgeon do surgery not being in the same room with the patient, or we're not at that level yet? If you were getting there.
Yeah, we're not there yet,
okay,
but it will come.
It will come. Okay.
But
with time.
With time will come. But what I was mentioning earlier was that the surgeon 100% of the time is in the operating room. 100% of the time is managing the instrument.
So you can breathe, people. The doctor is in the house. And speaking of doctor in the house, we have a phone call. Go ahead, caller. You're on the air.
Yeah, we're giving out free food baskets at the
Oh my God.
Okay, thank you so much. Thank you appreciate it. Okay, thank you.
Questions for the doctor or Deborah?
Well, I want to just, if you could explain how this works, because you asked a really good question, Juan, about is the doctor in the room?
Yeah.
How does this work? So we see that it looks like an octopus sort of robot thing.
Right.
What are the other components that are involved in the surgery?
Yeah, to make it functional.
Right.
Yeah,
so I'm just gonna briefly. The patient goes in the room, go to sleep. Okay, we prep the patient. I go to the patient, made 3 or 4 tiny holes. Put trocars that. We have, we put the trocars, these 3 or 4, okay, in different incisions. And then that's when the patient car, that is that one, comes and attaches to the trocars. This is when these arms, they attach to those trocars. And then I just move 3 feet away to sit in the console that we have there. The next one.
The seat.
This is the console where I sit, and through this. So we put the camera, and then I can see there is a small display here where I can see the surgical field. Okay. Then they put the instrument, and I have 100% control of the instrument. And and what I like about this is that it makes the operation safer because it's 10 times your eye.
I was just going to ask, is it less of a risk going this route?
The risk, so you see all the structures magnify. So there is less risk of injuring the surrounding structures. If I have a vessel that I need to divide, I can see it and I can divide it safer. And this machine is so, when you do not have the instruments in your surgical field, the machine will alarm. I say, where is your left arm? That's kind of the technology we have. And also the instrument, they are wristed like your hands. So you can achieve, or you can reach to certain areas of the body that you couldn't reach, even doing open surgery. So it is safer for sure.
There's also a panel, a display that the rest of the surgical team can see as the operation is being performed. That's a cool part.
Yeah, that's we call tower because it looks like tower.
Right.
So this is where I am seeing here in this right here. They are seeing it here.
So the whole team is seeing the same thing that you're doing, seeing at the same time. Correct. That way they know how to intervene or help or assist.
Correct.
There's another part that's cool is how the cuff system works for the hands, correct? It's a more comfortable.
Yeah, it's in the surgeon's hands going in.
Yeah, it's like a wristed instrument. Okay. So we call master control. So you can manage this instrument in a very smooth way. And there is a video out there that is how you can peel a grape skin with this device. So without injuring or without causing a tiny hole or something in the grape itself. So it's very delicate. If you have if your motion is more delicate, the risk of bleeding is less risk of blood transfusions, less risk of going home and coming back with pain. So there is a lot of benefit, and that's what I practice because I love it. My patients, they love it too. I get 1 or 2 stories every week. Like, I did surgery on Friday. They went back home on Monday. True story.
That's good to know.
They operate them today, and they are out of bed walking the hallway the next day. And I said, "Are you gonna go home?" "Yeah, I'm ready to go home." "Okay, let's do it." So and patients, they go home, they feel better, especially with this situation where we all have been living with the pandemic. You don't want to go back to the hospital because of pain to the ER. You don't want to have a wound infection and, now I have a wound infection, I got to go back and get admitted to the hospital. So if I can prevent this and this, I'm doing it.
Which brings a great question from what you're saying. In reading, the elective surgeries and preventive care has slowed during this pandemic, in part because of limited surgical opportunities or fear of the novel coronavirus, right? What can you say to those who are putting off their surgeries or their consultation, and what procedures are in place to keep them safe? I mean, I'm hearing a lot of safety precautionary measures, and I see that safety is a priority at the hospital and with your surgeries, but what can you say to them?
Yeah, I don't be afraid. We are, we at the hospital are completely safe, and we are focusing on your safety. That means that, like I said, we are checking temperatures. Everybody wear masks at the hospital. We are using hand sanitizer like never before. We're washing hands all the time during the day. And we change scrubs. We use scrubs for surgery. We change scrubs to normal, regular clothes, of course, and so to avoid the spread. And now the elective surgeries are back, and we are taking good care of the patients like we always have, and just don't be afraid.
Y lo mismo le pregunto en español, doctor Carlos González. Hay gente que tiene temor por lo de la pandemia, pero necesitan quizá cirugía, ¿sí? O alguna consulta. ¿Qué procedimientos están para asegurarse que todo va a estar bien? Pero ¿qué le aconseja a esa persona que está esperando?
Sí, no se preocupen, no tengan miedo de venir al hospital. Estamos haciendo, tenemos todas las medidas de seguridad para evitar contagio con el coronavirus. No se preocupe, estamos chequeando la temperatura en todos los pacientes que vienen al hospital. Estamos haciendo cada persona que está en el hospital tiene una máscara y nos cambiamos la ropa cuando entramos a operar y salimos de la cirugía y simplemente está bien segura. Todas las medidas que estamos tomando actualmente en el hospital están bien seguras y estamos haciendo cirugía con mucha satisfacción y ayudando, que es en lo que básicamente nos enfocamos.
I got a question. I got 3 nieces, triplets. They're all, and my little nephew, they're all going to school, pre-med, nurse, occupational therapist, and exercise. What is it? Exercise science or whatever that my little nephew's doing. Can a regular MD, can all MDs do surgery or not? Can all doctors do surgery or not? You know what I'm getting at?
Well, in order to do surgery, you have to have.
No, I'm not talking about robotic surgery. I'm just talking about normal regular surgery.
They're just
You gotta get a residency program.
You got to go through more schooling, so to speak, education to be a surgeon.
Correct.
And you just okay.
Yeah, correct. So, I mean, they can, if they are interested in surgery, they can go to the operating room and observe the surgery. And but they cannot. And some med students, though, they can assist during surgery or be there, but they cannot perform surgery for sure.
Before COVID struck, you mentioned the word right now, observe. Before COVID struck, and you were doing robotic surgery, did you have students observe you at any time before COVID?
No? What I haven't been able to do that.
Okay.
But what we used to do was just recording the procedures and then showing to them.
And going back to the question about power going out, I think all hospitals, I believe, have backup systems, generators, and so forth.
Yeah,
correct.
Definitely.
Okay.
But the robot works on its own energy.
Correct.
I mean, you're charging it up, so.
Yeah, it's
And it's good to know. I mean, it's a full day. It's not like it's going to get you in the middle of the surgery and oops, now it's dead. So it's safer. It's up to date. Now, I just have a weird question. Just like I always ask, how do they name these hurricanes? How do you name these machines, these robots, to make it the Da Vinci XI, right?
Well, that's interesting because I don't know why they chose that name. When they got copyright on it, they were probably thinking very creatively. What I love about the name
word
Da Vinci
sounds creative altogether.
Very creative because it is almost like
piece of art,
like
work
a
of art,
canvas, and it is so intricate that it is kind of like that.
Yeah,
and
that's what I was thinking of the name.
That Da Vinci was. I mean, when you think about the beautiful things that he painted with such intricacies.
Yes.
That it seems like a well-suited name for the.
That's why I was thinking of like the Da Vinci. It's like, okay, like the Da Vinci.
Yeah, because if you think Da Vinci, right, just beautiful precision, excellent. I mean, they look real. Everything he painted
to
looks
its perfection.
Real. Van Gogh, a little different story, right? So, so it's very suited, I think.
I guess this is a question for both of you. Of course, COVID is in. I watch a lot of talk shows and this and that. They talk about COVID and so forth. That may not be until it's maybe even after next year when we may be to some sense of normal, even if they do a vaccine, because it's going to take a lot of time to get everyone, 330 million people in this country vaccinated. But because of COVID right now, the things that you used to do as the marketing director for St. Catherine Hospital as far as community events about the great things that is being done at community hospital. Remember, I said I was at the demonstration for the former Da Vinci machine, or the previous Da Vinci machine in the lobby. Is there an opportunity because of the COVID right now to do something virtually as far as the demonstration of the Da Vinci that maybe we can talk about?
Well, we do have videos that we'll probably be building into our website. In fact, I think they may already be on comhs.org to kind of show what that's like. In our promotional materials, and when we talk to patients and do outreach and things, we do refer them to videos or can show them videos. And I'm really glad to hear that you're thinking about the virtual world because one, I know I've seen you at multiple community events that St. Catherine Hospital did or community healthcare system has done. And we're very conscious of the fact that we still need to continue to do our outreach.
Right.
You've heard me say this over and over again. We believe that the hospital has no walls, really. Our community outreach and the people that we serve in our area, we need to be out there with them.
It's needed.
Yes. So we are developing a very, we're in the midst of developing virtual programs that people can view on WebEx platforms.
Awesome.
I don't know if you've done Zoom and
all day long,
right?
every day.
So great.
I was on the Zoom coming here, so yeah, so it's the new way.
it is, and we're talking about different and innovative ways that we can kind of interface that with materials and things like that. Because, I mean, as you know, a lot of people are home now, and we need to say, oh well, sorry, we can't do this because we can't get to you, or you can't get to us. So we're working on it very diligently, and as a matter of fact, we have our Wings of Healing event at Christmas time.
Yes,
we're still going to do that in a virtual world, and as well as Lights of Life, which is at Community Hospital, and the Angel Tree.
Yes,
these programs, one supports cancer research and clinical trials, and the other two, the Angel Tree events at St. Catherine and at St. Mary's, supports a scholarship fund that the hospital auxilians do. So that's it. We're venturing into a whole new world. This is 2020 has been a year of
sounds like the song, a whole new world, which it is. And please, by all means, keep us posted with those events.
We will,
so that we can continue to inform and educate our community. Doctor, if I may, there is a question. She put it privately in the message. Her question is, she's had 7 surgeries. That's 3 6 sections, 1 hysterectomy, 1 bowel resection, and 2 hernia repair. Would she be a perfect candidate for robotic surgery if needed?
Yeah, I mean, like I said, 7 surgeries. She may have some intra-abdominal scar tissue that will make a little bit extra challenging the next operation, but it's doable. I have been there, and I did a patient yesterday where he had a couple. He had an open cholecystectomy, and before I was able to dock the robot with the arms, I had to do some extra lines of addition that took me 30, 45 minutes, but I was able to achieve my goal of fixing his hernia safely. So it is doable. It's not going to be easy. No, probably every surgeon is going to say, oh yeah, I'll do this for you, but but it is doable.
I have an economic question. Is it more expensive to have robotic surgery than non-robotic surgery?
Yeah, that's a very, very, very good question. It is not.
It is not?
It is not.
Okay.
And the reason why, because patients do not stay in the hospital, so the length of stay is less, okay? So patients have less complications. So if you have a wound infection, you spend antibiotics, readmission, maybe another surgery. If you put mesh, maybe the mesh gets infected, then you need to remove the mesh. So to make it simple, it is less expensive.
COVID and everything, and even before COVID, we're talking about a machine, so to speak, right? Preparation of the machine, maybe before surgery, preparation of the machine, and then whatever you call it, post-surgery, after the surgery is done on these Da Vinci X1. So are there people that come with the machine, so to speak, or that are trained at each and every facility where there is one that is in charge of maybe cleaning, replacing, maintenance, or whatever?
Yeah, we have a robotic team, okay, and the robotic team and I really wanted to point, especially the OR director Lori and everybody involved in our OR, because we put this robotic team is terrific, and it starts from nurses, scrub techs, material management, robotic coordinator. I'm the surgeon champion for that committee as well, for that team, and all this technology is they are reusable, the truckers, so for maintenance is very simple, and they did get trained for sure. The Da Vinci, the Intuitive Surgical, who owns this machine, they spend a terrific amount of training on a daily basis to make this team proficient and better every day.
Not all the details, but generally speaking, from the time you decided you wanted to be a robotic surgeon and the time you did your first surgery, how long of a time period are we talking about?
Yeah, it was probably about 3 months.
That was it?
Yeah.
Oh, that's great.
It was 3 months. And this even includes simulation. You have to complete certain amount of hours during the simulation, and you have to go to 3 basic Da Vinci robotic courses.
Okay, it's 10:48 p.m. AM?
AM, not PM yet. Don't rush it, man. For those of you that are listening, we thank you for joining us. And if you have any questions concerning, we have a caller? Go ahead, caller. You're on the air. Go ahead, caller.
Go. Okay, well.
Hello. Sí, tiene una pregunta. Sí, can you raise it on? Bendición. Buenos días. Can't hear.
Okay, bendición, gracias, my mom.
Gracias, señora. Es un orgullo de tenerla aquí con usted, pero me imagino que usted es la más orgullosa de tener un hijo como el doctor Carlos. Pues gracias, sí. Gracias. A usted, gracias por llamar aquí. Gracias. Saludos, gratos saludos desde aquí, Indiana, a Venezuela. Yo conozco a muchos venezolanos, los he interpretado. Okay, igualmente, gracias. Bendición, gracias. Qué sorpresa, ¿no, doctor?
Imagínate. Last words in terms of contact information for your office, for the hospital, and any information you have for our listeners and streamers that you want to leave them with in terms of whatever you want to leave them with.
Yeah, of course. So my main office is at St. Catherine Hospital.
Okay.
In the POB, in the professional building. I'm located in the 4th floor, 401, and the number to reach out is 219-922-8222. Again, 219-922-8222. And just call, make an appointment, ask for me, and I'll be very happy to see you as a consultation and get the best option for you.
Okay.
And I think we have one that she was asking for your contact information because she also added to all those surgeries that she has a mesh inside and a protrusion on the left side that looks like a tumor. So she may need some consulting real quick.
Yeah, and we'll need to see her, and still can be done, and maybe the mesh needs to come out and put a new mesh or no mesh at all. So we'll need to see her first and decide.
Wonderful. Thank you so much. Para quien quiera más información o una consulta al doctor González, ¿a dónde podemos acudir? ¿Dónde llamamos? ¿Con quién?
Sí, mi oficina principal está en el hospital St. Catherine's. Estoy localizado ahí en el piso 4, en la oficina 401, y puede llamar al siguiente número, 219-922-8222. Otra vez, 219-922-8222. Llama y pregunta por mí para hacer una consulta, y estaría bien agradecido de verla y para ver qué es lo mejor para usted.
Doctor, if I can ask you this question. I know when it comes to the medical field in this country of these United States of America, there's a great lack of Hispanics, Latinos, which way, you would prefer to be called. I prefer Hispanic as opposed to Latino. Can you say something to our Latino Hispanic population to encourage them to pursue the medical field, because there are a lack of Hispanics, Latinos in this country as it relates to the medical profession. Is there something that you can tell our Hispanic-speaking population to encourage them to look at that field?
Yeah, of course.
En inglés y en español, por favor.
Sí, los Estados Unidos para el entrenamiento, no vas a tener mejor entrenamiento que aquí en los Estados Unidos.
Okay.
Yo era cirujano. Yo hice cirugía general en Venezuela.
Okay.
Y me faltaba algo. Yo tenía que ser mejor. Y vine acá y todo lo que he logrado, y de una manera, de la manera como te educan aquí en los Estados Unidos, no vas a tener más que eso. Los que nos están escuchando, si tienes dudas, no dudes. Venga y haga entrenamiento acá, que va a ser espectacular.
Y es muy necesario. Yo como intérprete he entrado en lo que se le llama el campo médico, ya sea psicológicamente, médicamente, un examen físico por parte del Seguro Social, y he visto que hacen falta esos personas que hablan en español.
Correcto.
Como yo me están usando a mí el servicio de interpretación, veo donde se necesita. Aquí se necesita bastante, porque están utilizando a una enfermera que habla Spanglish para traducir, donde no es justo para el paciente ni para el doctor, porque hay una falta de comunicación. Se entiende a medias, no completamente. Es necesario.
Sí, esa es una de las cosas por las cuales yo me enfoqué en el St. Catharines. Yo vengo de un barrio pequeño, de una comunidad pequeña, y me gusta mantener eso, donde yo voy a hacer a la gas station y veo a mi paciente, donde es un hospital bien comunitario, y me enfoco en ayudar a todos por igual, pero como la comunidad hispánica está más grande en el área de East Chicago, ahí es donde me quiero enfocar, ahí ayudar a los hispanos.
So on that note, we want to thank you, Deborah. We want to thank you, Dr. Carlos. And we still, I think, have about 5 minutes, so we can take a little time to, you can just make some quick announcements. This Tuesday coming up is November the 3rd. There's been at least 85 million people that have voted already. So this Monday coming up, Eve and I are going to be doing a special Facebook Live program, not from the studio here, of course, at 7 o'clock. So this Monday at 7 o'clock, Eve and I are going to be doing a special pre-election Facebook Live program for our Facebook for Nuestra Comunidad Northwest Indiana. You can still vote early in some states, because I think yesterday was maybe the last day to vote early in other states, but in the state of Indiana, you can still vote early today, and you can still vote early on Monday, I think up until 12 noon. Mm-hmm. Don't wait until election day. And if for some crazy reason you still have an absentee ballot in your possession, don't mail it. Don't mail it. You got to take it over to the voter registration office in Crown Point. So we have a phone call. Go ahead, phone call.
Go ahead, caller.
Go ahead, caller.
Hello.
Yes.
Hello there.
Wayne, how you doing?
Good morning.
Great.
Good. How are you?
Okay, I will be remiss if I did not call and tell you guys congratulations.
Well, thank you, Ned. Appreciate that. Appreciate you as well.
Thank you so much.
Thank you for hanging in there with us.
Working hard and reporting events and different things. So it's just big about taking care of making sure that everybody knows what's going on and protecting everybody. So thank you so very much.
Thank you.
Thank you,
We
Ned.
appreciate you, Nat. Be blessed.
Okay. All right. I will. Thank you. So if you have an absentee ballot, I'm talking about the state of Indiana or anywhere right now, take it to, you got to take it. Don't mail it. It's too late.
Yeah.
It won't get there. Every state has a different rule. Let me say this once again. In Indiana, if you have your ballot in your possession right now, only you can handle that ballot and take it over to the county, or someone that lives in your household can take your ballot and take it over to the county. No one else, because if someone else that has your ballots and it's not you, the voter, and it's not someone that lives in your household, you're committing a felony.
And we don't
Be aware
want
of
that.
that.
Yeah.
Be aware of that. So it's got to be you, the voter, or someone that lives in your household can take the ballot to Crown Point if you live in Lake County, Indiana. No one else can do that. If they do that, they're committing a felony. On that note, we're glad to see
Yes,
Miss Winter
we got
back
Miss
here
Winter back.
today.
That's
We
right.
haven't seen her in a little while. She went through a little something, but we're glad she's
Thank
she's
you
good.
for being here.
So we thank you. This was our anniversary weekend show, with our anniversary show actually yesterday, the weekend today. Two very powerful guests, Dr. Carlos Gonzalez about robotic surgery, Deborah G. Brown, marketing manager for St. Catherine Hospital. So I guess look for some things on a virtual basis.
Yes,
coming
stay
from
tuned.
St. Catherine Hospital
Stay
until this
tuned.
thing ends. Which
That's right.
It's still going to be some
Whenever
time.
that will be.
Right.
Yeah.
Pero no se les olvide. I mean, thank you for coming on the
Thank
show.
you and happy
thank you.
anniversary.
Thank you.
That's
Thank
right.
you so much. And we look forward to bringing you back.
course.
Always giving us updates of what's happening or not happening. I know that we've had other doctors on the show that also represent St. Catherine's, and they have their own practice because we need to inform and educate our community, especially English non-English speaking community. They don't know where to go. They have the language barrier as it is, and some doctors don't inform them that they should be informed. And so I'm going to speak on my behalf because I'm in the medical field as an interpreter, but also as an advocate and a mentor. It is so needed to speak their language. Tenemos muchos que no entienden el lenguaje y es muy importante que sepan lo que deben de saber de acuerdo a su salud médica, especialmente en estos tiempos que no sabemos la inseguridad, lo que pueda pasar mañana. No se preocupen porque hay una solución siempre. De acuerdo al CDC, tenemos que, como nos ven aquí nosotros, protegernos del tapabocas, mascarilla, máscara, como le quieran llamar. Es muy importante de lavarse las manos muy seguramente, lo que deben de hacer como quiera, y es algo que debe de ser un hábito en sus casas. Enséñenle a sus hijos, eduquen a sus hijos, pero también sigan educándose ustedes como padres de familia, porque el que está ciego no llega a ningún lugar, a menos de que pregunten. Como dice el dicho, preguntando se llega a Roma.
Yeah.
Así es que estamos aquí siempre con nosotros, con ustedes, en nuestra comunidad. Gracias, doctor Carlos. Gracias, Deb, por venir aquí con nosotros para educar a nuestra comunidad. Y regresamos el viernes a las 5 de la tarde. Thank you for joining us. We'll be
And
back
one last
Friday.
thing, today is August 31st.
You mean
How-
October 31st?
October 31st. Why did I say
I don't know.
But either way, ladies and gentlemen, if you're going to go out trick-or-treating, do it safely and check all the candy before your kids eat the candy.
Mejor ni se
Check
los
it.
coman porque luego van a ver un
Thank you.
dentista.
We love
Y en
you
esa nota,
all. We love
voten.
you all.
Su voto es su voz.
Yes.
Si no votan, cállense la boca, pónganle un cierre, no digan nada, no se quejen. Por favor, usen ese derecho que tienen de votar. Si son ciudadanos americanos, vayan a votar. Hoy todavía se puede votar hasta las 4:30 de la tarde, y el lunes hasta mediodía, que pueden votar temprano aún todavía, o esperar hasta el día 3 de noviembre, y que el mejor gane para nuestra comunidad. Nos vemos.
Sí, gracias.
Cuídense. All right. See you guys on our Facebook. See you
so
guys on our YouTube. Nos vemos. Hasta la próxima. Thank you for joining us.
Here for you guys.
Oh, more is always good. You can